Hi, this is the training video for the nasopharyngeal swab or PCR. Your patient will check in with the on-site team. The on-site team will hand them a specimen tube and a swab. Okay. At this point, this is where the on-site team will instruct them to use Purell. If not, once they sit at your station, please start with having them clean their hands with Purell. Okay, make sure it's nice and dry because we don't want the alcohol to get onto the specimen tube. The on-site team will place the label onto the tube, have them verify that their first and last name is correct and that their date of birth is correct. And right there below, right beside, it'll have a hashtag or number sign. Instruct them to write down your station ID number, okay? Now, also remind your patient to keep their mask on the entire time. So you only want them to have their nose exposed, so have them keep their mask on like this, because they will definitely sneeze with this particular swab. This is the one that goes in fairly far, pretty far in, okay? They may sneeze, and the last thing we want them to do is just throw droplets all over, because it does take some time for that to clear out, okay? All right, so when they have their mask on like this, and they've written all the information on here, have them take off the cap, place the cap on the table right side up so it doesn't get contaminated, place the specimen tube in the tube holder in front of them, or tell them the plastic thing with holes on it, because there's a solution in here we can't let spill over. Okay, I'm just going to take this off. You get the idea by what I mean. Have them keep their mask on at all times, okay? So now have them take the specimen swab or the swab. It says peel here up top. Instruct them to just peel open about 1 inch so they can reach in and grab the swab. So we use different swabs, but know that the location is the same. Doesn't matter which one we use. So this particular one has an indentation, okay? So this swab needs to actually go in this far into the person's nostril. So have them take the thumb and pointer finger and have them place it right over that indentation, that demarcation right there, okay? And then tell them when they insert this into their nose, or you need to go at the center, and they're going to need to angle towards the back of their ear or towards the back of their throat. A lot of people have the misconception that they're going to poke their brain, and you'll see them come down from this angle, and that's not what I want you to instruct them to do. Okay, so the correct way is have them sit off to the side, tilt their head back, keep their mouth open with their mask on, of course. And again, their fingers are pinched right over that demarcation line. Okay. Have them tilt back, have them insert into their nostril, okay, towards the center, and they're going to insert towards their ear, towards the back of their throat. And then once their nose is touching their face, okay, that's how you know they're at a right location. Now they're going to be tearing up, they're going to be sneezing with this one. Know that that is okay. Once they're here, you're just going to have them swirl the swab for 5 seconds only, okay? 5 seconds only, and I need to see a big, vigorous swab for 5 seconds. So 1, 2, 3, 4, 5. If you see that they're not swirling that stick or rolling it, if they're rolling it slowly, stop counting. Start recounting if you see them actually start rolling correctly, okay? Because it's in this roll that we're getting the correct amount of samples. So 1, 2, 3, 4, 5. Go ahead and slide out. Place inside the specimen tube. Have them bend the stick right where that mark is, okay? And then have them place the cap on. Now they're done. Have them follow the exit sign where they will scan and submit to our on-site team. Thank you.